What I want to talk about actually is not books and it's not jazz. I want to talk about magic today for the next half an hour or so with you, and talk a little bit about creating magical experiences in healthcare, but not just generally. Because we're Google, I want to talk about creating magical digital experiences in healthcare. And so this is a little bit like, you know, if you go and see David Blaine or Penn and Teller, or for those of you old enough to remember Doug Henning, The Illusion, right? It's neat to see the trick, but it's also neat to understand how to actually do the trick. So I'm going to show you some magical experiences, but then I'm going to unpack a little bit of, at least from our perspective at Google across the alphabet companies, how we think about putting together, assembling a magical experience, and hopefully that'll be some good practical advice that each of you can take away back to your companies to go and create magic following this awesome conference. I had a little bit of a magical experience on the way here. I do live in Chicago, and that's my actual phone, and that was the actual high temperature on Friday. It has not been above 19 degrees in Chicago for 15 days. So for all of you complaining about the San Francisco weather here, it's balmy and nice to me. So I guess it's all a matter of your perspective. But as I was getting ready for my trip, my Android phone knew from my entry in Google Calendar that I was going to be out here in San Francisco. It saw that entry and magically pushed at me not just the Chicago weather, but the San Francisco weather, some tips on what to see, some restaurant recommendations based on the fact that it magically knew I love wood-fired pizza and gave me a couple of recommendations here in the neighborhood for that for dinner tonight. And so, you know, that's not a healthcare experience in any sense, I guess maybe in the sense that better weather is good for my health. But it was just a simple magical experience that happened in a personalized, instant, and very relevant way. And so that's the kind of mindset that we think about at Alphabet at Google when we go to create magical experiences. And so these kinds of things that are now your consumers, your patients are experiencing, whether it's weather or pizza, they're bringing those expectations to the patient pathway and patient journey as well. So I pulled a little bit of data for you that I'll share throughout this presentation. But over the past couple of years, we are seeing in Google search, searches for best and searches for now up 4x and 3x. So what do I mean by that? Best wood-fired pizza downtown San Francisco, right? A restaurant with a table available near me now. These kinds of queries that include best or include now are rapidly, rapidly increasing. And so that's the set of expectations that the consumer base, the population, the patient base that you're all working with are experiencing and bringing when they're looking for magic from you. This is the set of expectations that they're bringing when they come to see you and your products. Just a little drill down on that. Queries for best hospital up the past 2 years, 156%. Best health insurance, best diet, best physician. And it's not just general, it's specific things like best RA drug, up 124% over the past couple of years. On the wellness side, best fitness app, double, 101% up. So these are the kinds of behaviors and curious questions that these patients are now bringing forward as a mindset. That's on the best side of things. On the instant, right here, right now side of things, near me searches in the healthcare and wellness space, and this is a 5-year view, are up 60x over the past 5 years. And so you can see color-coded here, pharmacy near me, hospital near me, dentist near me, doctor near me. You see those things radically increasing. So I know that we always have to be careful about talking about the consumerism of healthcare. It's not the same as buying a new carpet, looking for an RA drug. And I don't want to confuse or conflate the two, but I just wanted to share with you the context of this instant, personalized, relevant, near me, and now is happening in the categories that you work in as well. And by the way, one interesting little tidbit is we actually are starting to see a flattening of searches in the healthcare space that include near me, because people on their phones now are realizing they don't have to actually put in the modifier near me. They can just put in dentist open now. and the phone knows, right? Google knows where you are, lat, longe, geolocated, etc. So I don't know that we'll continue to see that up 100% as people get smart and know they don't need to put that in. So the question for all of you then becomes, in this magical age, in this age of best, now, instant, relevant, right, the zero moment of truth age, how do you in the healthcare space, trying to create magic, how do you keep up with that magic, right? Well, magic, let's think about that for a minute, right? That's the power of apparently having undue influence or a special set of powers over the course of events, how to change things. Well, let's look at some other magical experiences. I showed you my weather search earlier that showed me some magic, but here was a magic experience I had yesterday morning. I wanted some coffee from Starbucks. Sometimes I go to Pete's, sometimes I go to Starbucks. But on Saturday morning, at least at the Starbucks in my house, there's a whole big long line, and it's quite a hectic experience. So magically, Starbucks, through their text ability, lets me now text my order in. So this is separate from the app, this is separate from the drive-thru. You can text your order to the Starbucks near you, which is kind of cool, right? That's undue change over the seemingly normal course of events. That was a magical experience I had interacting with Starbucks. Liberty Mutual. I've got 2 teenage drivers at home, and with that comes a couple of obligatory fender benders. And Liberty Mutual was able to help me get an estimate and a repair in less than an hour without ever having to take the car into a shop from a front right fender ding, just by taking a series of photographs through their claims app. They approved it. They gave me 3 different garages that would repair it. They then allowed me to schedule it through the app. Done, right? So, you know, we've all been in this situation where this is a anxiety-filled, apprehensive, you know, not unlike a healthcare kind of a situation, right, in terms of human emotions. And the magic of Liberty Mutual made that go away. And then a third magical experience, I travel a lot for this fun job that I have, and increasingly I've been staying at Hilton's because of the magical digital key that's now available in something like, I don't know, 2,000 or 5,000 Hilton's worldwide, where not only can you check in advance, but instead of getting that little plastic key card that you have to, oh wait, my phone is in this pocket, I have to put the key card in that pocket because otherwise it'll demagnetize, you know, that kind of juggling act that you have to do, not to mention waiting in line at check-in. Well, now your phone becomes the key, you tap, and through the magic of NFC, I can unlock my room and walk in. So these are some of the magical experiences that other great brands are doing that are, you know, not prototypes, they're not innovation tests, these are real live products that are out in the world right now that your target audience is experiencing. But what could be more magical than medicine? You all are in the most magical of all domains. And if you think about that, it's got a long history of medical magic changing the world. Middle of the 19th century, right? Germ theory came out of 1850s in London where there was a cholera outbreak. And it was actually identified that it wasn't some magical thing making everybody sick, but it was actually germs out of the Broad Street water source in downtown London in 1848. Magic changed the course of the world. Röntgen, 50 years later, 40 years later or so in the 1890s with the magic of seeing through bodies with x-rays. And that's magic that still happens every single day in healthcare facilities all day long. Magic, right? Changing the course of patient outcomes and changing lives. And then, of course, Fleming's discovery of penicillin in the 1928 era changed the course of the world, right? In many cases, changed outcomes. These are not magic, but they are magical in their outcomes. And that's why I love all the things that each of you are working on every day, because you are applying practical magic to change people's lives and change outcomes. And for us at Google and for Alphabet and all the different divisions and groups that Ryan named, we're, from our perspective, trying to do our part to add a little magic where we can to fuel outcomes and better patient results and outcomes in the world of health as well. And it's digital that's powering this magic. And you know, I know you're all familiar with Dr. Topol's excellent book from a few years ago that foresaw, foreshadowed, foretold the power of digital to add magic to future healthcare experiences that in the 5 or so years since he's written this book have started to manifest and come to life. And as our Venrock speakers just pointed out, and I totally agree, we're still in first inning, early days of this. But it's starting to come true what Dr. Topol foretold several years ago. Dr. Jessica was here from Verily earlier, and I know talked about the continuous glucose monitoring contact lens. And, you know, for those with diabetes, this is practical magic, right? This is changing the course of lives. She talked a lot about that earlier. I won't go into that further. One that we're working on that I particularly like is the LiftWear project, right? That for patients that are afflicted by diseases or conditions that have tremors, Parkinson's, etc., the ability to stabilize the utensils is magic, right? To be able to actually feed yourself normally, quote, right, is practical magic that changes patients' lives, and we're proud to have a hand in that one as well. This is our Dexcom partnership that you've heard about. This is for both type 1 and type 2 diabetes, but it's a coin-sized sensor that hopefully will come to market here shortly as a first of a couple of phases that we collectively with Dexcom have imagined and envisioned. But again, for patients with diabetes to be able to do continuous glucose monitoring without having to do any finger pricking, blood testing is magic, right? For those of you who have yourselves or friends or family or neighbors afflicted with diabetes, this will be a magically improved outcome to help improve lives. Another project that we're working on that I think has a magic application to it as well is our so-called Project Debug. Now, normally in the world of Google, when we talk about debug, that means debugging software or finding errors in software lines of code. But in this case, we're working with the Mosquito Abatement District up in the city of Fresno to think about how can we reduce mosquito-borne infectious diseases and ailments. You know, mosquitoes carry disease that unfortunately has morbidity, kills over 1 million people worldwide globally. And for those that it doesn't kill, if you think about Zika and some of those kinds of things, there's millions more afflicted by mosquito-borne illnesses beyond that. So what would be a magic way to think about changing lives and changing patient outcomes for mosquito-borne illnesses? Well, our Project Debug is actually doing this, where we are working to release 1 million male mosquitoes into Fresno with the Mosquito Abatement District there, 1 million a week over the course of 20 weeks. So 20 million male mosquitoes who we have given a bacterial condition that sterilizes them. And that's a naturally occurring, this is not genetically modified, that's a naturally occurring affliction that happens to male mosquitoes in the wild, but not in the Fresno Valley. The idea then is that those sterile mosquitoes will mate with female mosquitoes and greatly reduce the afflicted population and then the ability to carry mosquito-borne disease in Fresno. And so if this works, that could radically change lives and bring magic to parts of the world like Puerto Rico, like Cuba, like the Bahamas, like Brazil, where mosquito-borne illnesses are highly prevalent. Not in Chicago, where it's 5 degrees and all the mosquitoes freeze hard this time of year, though. Another magic project that we're working on is identifying early-stage diabetic retinopathy. Now, diabetic retinopathy is one of the fastest-growing causes, as you know, of blindness, but it's preventable if caught early. The problem is, in many parts of the world, people who have this in an early stage don't have the ability, the access to visit advanced healthcare clinics and well-trained ophthalmologists. So here, what we did was feed about 75,000 training images into an artificial intelligence and ML system that then was able to identify at the stage equivalent to board-certified ophthalmologists in the US these retina photos, so that way people in other parts of the world or even other parts of the US that don't have the ability, the access, the means to get the same healthcare treatment from ophthalmologists like you or I do here will now have the ability to get this disease recognized early and be prevented from blindness, which again is a magical outcome, something that we're proud to be working on. This is another interesting one that we're working on with the International Rescue Committee and Pfizer as a joint project. You know, in many parts of the world, for some, I don't know, 3 to 4 billion people out of the 7 or 8 billion in the world, they don't have a physical address. Like if you ask me what my address is, I can read it right back to you. But there's billions of people that don't have that. And in many cases, that hampers the ability for healthcare workers to be able to go to a place, to your home, to your address, and deliver a healthcare outcome. And so we're working on something here that you might think of as bit.ly for your lat and longe. Right? So for folks in Somalia, in this case, they're given a short access code, an open source and open location that shorthands the latitude and longitude into something that might look like a zip code or a UK postal code, 8 digits or so, which they can then tell healthcare workers, this is my domicile, this is where I live. And so we're doing an early pilot, and actually in Somalia, to help deliver both vaccinations and family planning to people based on this short code address. So we'll see where that one goes. But boy, would that be magic then for billions of people around the world to be able to receive healthcare workers, because they now have a place to tell the healthcare workers where to come deliver the healthcare. But that's just some of the things we're working on. This is a Seabee Insight slide that I like that shows a lot of the magic that's happening outside of Alphabet and Google and Verily and all of our companies. Many of your companies are represented on this slide. It's not a judgment slide or a representative slide by any means, but it's just meant to indicate that we're aware and very proud of all the work that many of you are doing, all of you are doing in this space to bring practical magic based on the startups and the innovations and joint ventures that each of you are working on. Okay, so now you've seen some magic, but as I promised you, let's pull back the magician's curtain a little bit and think about, is there any sort of approach to creating these kinds of magical healthcare experiences? And of course, since we're Google, I have to put a little bit of an algorithm, math formula kind of together for you to show you this. And what all those magic experiences had in common, whether it was my not having to wait in line at Starbucks or not having to go to a claims center for my insurance, or to be able to have vaccinations delivered to my house in Somalia, is they reduce patient friction, right? So what we want to drive is minimizing big F, friction, if you will. And to do that, that's a function of C times A times N, we believe, where C is you satisfying patient curiosity, A is you delivering patient assistance, and N is solving for now. Remember that impatient consumer that I showed you, 60x search in near me now? So let's unpack those briefly a little bit, and maybe that can give you some thoughts on how to build magic into your startups and in your projects by minimizing friction with C times A times N. So let's start with satisfying curiosity, and we'll fly through this pretty quickly. So what are they searching for? Let's take a quick look at a 2-minute video of what people in the world are searching for at the end of 2017, where you can apply magic. If you can play that video, please.
Do everything we can. We are Vegas strong.
No matter what we're going through, we still have to push forward.
Are you ready to shake up the world?
It takes an act of love to realize we are all in this together.
We made history tonight.
Look at that! It's emotional. I can't explain why, but it is.
I'm asking that you guys join and mobilize with me.
I will say it right now out loud. Me too.
Me too.
Me too.
Me too.
Put your hand back out, bro. You gonna shake it, bro.
superpowers. Go out there and conquer the world. Because the world would not be as beautiful as it is if we weren't in it.
So people are searching for your magic. They're curious. Do you know for your project, for your startup, for innovation, what's the how that your prospective patients, target audience, or customers are looking for? Know your how. That's the first element to create magic. And so in the healthcare space, 86% of users, that's most everybody, have a how when it comes to symptoms. They go online, they ask questions. How do I address this? How do I care for that? What's the how in your space? Because knowing that how is the first key element to creating magic. It's the C in curiosity. And patient satisfaction plummets when that how is not satisfied. We know this from this study and others. Let's look at A, assistance. Now that you have an element of how and curiosity, how do you provide assistance to these folks? Well, 84% of research treatment options actually happen online after an initial diagnosis. So when we look at search volume across the patient pathway, it's not before seeing a healthcare professional that there's the most search volume. It's actually following that first interaction or that first visit. When perhaps a diagnosis, a hypothesis, a treatment direction has been given, your patients, your target audience then go to learn more. They want further assistance than they were able to get in that brief interaction with a healthcare professional. And so one of the things that we're doing at Google is when you do searches for certain conditions, partner with Cleveland Clinic and Mayo Clinic, and in this case, if you do a search for clinical depression, you'll see that little arrow on the left-hand side where it says, check if you're clinically depressed, learn more. I need more assistance. And a little depression screening questionnaire, one of 9 questions, pops up that we worked on in partnership with the folks at the Mayo Clinic. So again, this is another way where we're trying to satisfy not just the curiosity and then be assistive in the experience. On the consumer health side, this is a J&J product, Zyrtec, of course, and that's our Google Home device. So you can talk to that device, you can ask it questions, and it will come back with answers. So they created a skill, if you will, from Zyrtec, where you can say, hey, Google, ask Zyrtec what the pollen count will be today. Will it be a good day for me, or will it be a rough day for me if I'm a severe ragweed allergy sufferer, for example? And then Zyrtec comes back with both a verbal readout of what the pollen count will be and some things to help manage your symptoms or manage your condition, some assistive advice along the way, if you will. So that's curiosity, but then that's also being assistive. On the provider side, we've worked with the folks at Stanford in the dermatological space to use ML to detect skin cancer to be assistive to the provider. And by the way, this week at CES in Las Vegas, I'll be there tomorrow, the folks at Neutrogena, another J&J brand, are introducing their next hardware device that attaches to the camera on your phone to help you learn more about skin conditions and potential treatments based on moisture levels and skin condition, et cetera. So a lot going on to help brands be more assistive in that second element of creating magic. And then lastly, don't forget that element of now, that instant that we talked about. A study was done a couple of years ago that said the human attention span is 12 seconds. That's scary, but of course a goldfish has an attention span of 9 seconds. And that's even scarier. And even scarier was the fact that this study was just updated and the human attention span is now down to just 8 seconds. So I hope you're all with me through a couple of minutes, more than 8 seconds here. But this is just reinforcing this element of we need the information, we need your assistance, and we need the curiosity satisfied from you now. Not later, not over time, not maybe, but now. And it's mobile, of course, that's driving this. Now more than half, 55% of all searches that we see on Google.com in the healthcare-related space are mobile-related searches. And that somebody on mobile is someone who wants an instant answer now. And this chart is just a fancy study that we did a few years ago that shows if you do not satisfy their curiosity now, if you take 3 seconds, 4 seconds, 5 seconds, 10 seconds, you will see that conversion rate, satisfaction of people on your mobile site, drops precipitously after 2.4 seconds. Okay, so remember, attention span is 8. For your mobile site, it's 2.4 seconds. Okay? By the way, a little freebie here for you. You can go to testmysite.withgoogle.com and see how quickly your mobile site or your mobile application loads. And there's some great examples here. Mucinex is doing a terrific job in this space. WebMD with its cold and flu map is doing a terrific job, less than 3 seconds when these load. Walgreens is doing a terrific job in this space as well, with even its online patient and doctor finder. So, to wrap up, heading into 2018 as we kick off the year here, what can you do? What can you do in this startup health space to create magical experiences that improve patient outcomes moving forward? Well, I hope you've got the message from my talk here today. Go create magical experiences. Experiences that deliver magic to patients in that moment when they want to know something. Deliver magic in that moment when they want to compare something. Deliver magic in that key moment when they want to do something. Or deliver magic in that key moment when they want to buy something. Figure out what your magic moment is, where you can apply practical magic. And then, remember, magic happens when you know your patient better, when you assist them everywhere, and of course, when you help them faster. Speed really matters in this area. So with that, I wish you good luck. And the Star Trek apologies, please go forth and reduce friction. Go forth and create magic. And with that, I thank you and wish you a great 2018.